Many people that we work with weren't necessarily even aware that they had COVID at the time, and their acute presentations were very mild. The subsequent months after initial infection started to bring on a number of different symptoms that weren't even necessarily present in the acute phase, and they started to develop kind of ongoing progressive worsening of symptoms, often brain fog, fatigue, and symptoms associated with dysautonomia like dizziness or headaches. There's a common misconception that individuals with long COVID become deconditioned very quickly because often they have to significantly reduce their activity in order to stabilize or improve their symptoms and get out of what we call the push crash cycle. The reality is the amount of kind of deconditioning that naturally happens is often not what's driving the continued issues that someone experiences with long COVID. So if someone goes to do an activity of daily living like cooking a meal and notices a significant spike in their heart rate, that is not because they are deconditioned or out of shape, that is their dysautonomia. So we can help people kind of identify when the difference between these two, and then help to build a plan to help them better manage the dysautonomia part of it. We can use some of that biometric monitoring to help identify where some of these thresholds might be and give people specific recommendations around heart rate limits or activity limits to ensure that they are staying below that threshold, so that they can do some amount of activity potentially without triggering that PEM or PENE response. Virtual care allows us to meet patients where they are in the environment that they are most comfortable in. Many of our patients take our appointments virtually from their couch, from bed. They can take breaks more easily. If you think that you might have a post-infection condition, would be to reach out and book an initial assessment with one of our physiotherapists. In that initial appointment, which is 60 minutes long, we'll go through a full clinical history, past medical history, and look at sort of what your day-to-day symptoms look like, what your day-to-day function looks like,